Hello, we are students from the University of St. Joseph, and in this presentation, we will be discussing the topics of eczema and other skin rashes. Eczema, also called atopic dermatitis, is a condition that makes your skin red and itchy. It is common in children but can affect individuals at any age. It is a chronic, long-lasting condition with flare-ups periodically. Eczema for most people begins before the age of 5 and may persist into adolescence and adulthood. For some people, it flares up periodically, then clears up for time, even for several years. Flare-ups can be accompanied by hay fever or asthma. No cure has been found for eczema. Treatments and self-care measures can relieve itching and prevent new outbreaks. For an example, it can help to avoid harsh soaps, moisturize your skin regularly, and apply medicated creams or ointments.
Symptoms of eczema include dry skin, itching, which may be severe, especially at night, red to brownish gray patches, especially on the hands, feet, ankles, wrists, neck, upper chest, eyelids, inside the bend of the elbows and knees, and in infants, the face and the scalp. Also, small raised bumps which may leak fluid and crust over when scratched, thickened, cracked, scaly skin, raw, sensitive, swollen skin from scratching. You should see your doctor if you or your child are so uncomfortable that the condition is affecting sleep and daily activities. Has a skin infection, look for red streaks, pus, or yellow scabs, or if you continue to experience symptoms despite trying home remedies.
Bee stings. Reactions from bee stings can range from mild to severe. A reaction includes instant, sharp, burning pain in the sting site, a red welt at the sting area, slight swelling around the sting area. A severe reaction includes skin reactions, such as hives and itching or flushed or pale skin. Difficulty breathing, swelling of the tongue and throat, and loss of consciousness. Bee stings can often be managed at home. If someone is having a severe allergic reaction, call 911 immediately. If someone has an EpiPen, use immediately as directed. Prevention is key. The following tips can help reduce your risk of getting stung by bees. Take care when drinking sweet beverages outside. Wide open cups may be your best option because you can see if a bee is in them. Inspect cans and straws before drinking from them. Cover food containers and trash cans. Clear away garbage, fallen fruit, and animal feces, which can attract wasps. Wear closed-toed shoes when walking outside. Don't wear bright colors or floral prints, which can attract bees. Don't wear loose clothing, which can trap bees between the clothes and your skin. When driving, keep your windows rolled up. Be careful when mowing the lawn or trimming vegetation. Activities that may arouse insects in a beehive or wasp's nest. Having hives and nests near your home removed by a professional. It is also important to know what to do when you are exposed to bees. If bees are flying around you, stay calm and slowly walk away from the area. Swatting at an insect may cause it to sting. If a bee or wasp stings you, or many insects start to fly around you, cover your mouth and nose and quickly leave as soon as possible. When bees stings, it releases a chemical that attracts other bees. If you can, get into the building or a closed vehicle. Remain calm and seek medical attention if you are having a severe reaction. Insect bites, such as mosquito bites, are usually mild and can go away on their own without treatment. For mild reactions, first move to a location where you will not be stung again. Wash the affected area with soap and water. Apply a cool compress to help with pain and swelling. Apply 0.5% hydrocortisone cream, calamine lotion, or baking soda paste to the bite or sting several times daily can help reduce symptoms such as itching. Usually the signs and symptoms of a bite or sting will resolve in a day or two. If you are concerned, even if your reaction is minor, call your provider. Seek emergency care if you are having symptoms of a severe reaction. Prevention is key. Use a natural insect repellent and wear light-colored clothing. Stay indoors during dusk or dawn when mosquitoes are most active. Dump any freestanding water near you at your home. These places where mosquitoes can breed. Keep mosquitoes and other insects out of your home with screens and windows, also keeping your doors closed. Burning citronella candles can also help.
Tick bites. Most tick bites are painless and only cause minor signs such as redness, swelling, or a sore on the skin. If the tick is embedded, remove promptly with fine-tipped tweezers. Grasp the tick as close as possible to the skin. Pull gently and steadily. Avoid twisting or squeezing the tick. Watch for signs and symptoms of Lyme disease. Watch for a bullseye rash. From an infected tick bite, a bullseye rash can develop. It's an expanding red area that might appear sometimes clearly in the center of the back in a bullseye pattern. The rash expands slowly over days and can span to 12 inches across. It is typically not itchy or painful, but might feel warm to the touch. Symptoms of Lyme disease include fever, chills, fatigue, body aches, headaches, neck stiffness, and swollen lymph nodes can accompany the rash.
Poison ivy. If you come into contact with poison ivy, oak, or sumac, wash your skin immediately with soap and water. It is the oily resin, urushiol, which causes contact dermatitis, or a skin rash. Urushiol on unwashed clothing or objects can cause a reaction even years later. The reaction usually develops in 12 to 48 hours after exposure and lasts 2 to 3 weeks. Symptoms include redness, itching, swelling, and blisters. Poison ivy rashes can usually be managed at home with cool baths and soothing lotions. You may need prescription medication for a rash that is severe or widespread, especially if it is on your face or genitalia. Prevention is key. Wear long clothing, avoid the plants, or remove or kill the plants that are in your yard. Wash your skin or your pet's fur and clean contaminated objects. Sunburns. If you have been sunburned, symptoms will appear within a few hours post-exposure. The affected skin can be painful, red, swollen, and may have blisters. You may experience headaches, fevers, or nausea. Treat the sunburn by cooling the skin. This can be done by applying a cool, damp towel to the affected area. Apply a moisturizer. An aloe vera lotion or gel may be soothing. Drink plenty of water to prevent dehydration. Don't break small blisters. If blisters break, gently clean the area with mild soap and water, apply an antibiotic ointment, and cover the wound with a nonstick gauze bandage. Take a pain reliever such as ibuprofen or Motrin to help with the discomfort and swelling of the sunburn. Avoid more sun exposure while your skin heals from the sunburn. Prevention is key. Wear sunscreen and reapply it. Wear wide-brimmed hats, long-sleeved clothing, and sit in the shade whenever possible.
Your skin is the largest organ and your best protection from infection. Skin helps regulate your body temperature and helps excrete toxins through sweat. Take care of your skin, wash with a gentle cleanser, and moisturize it daily to keep it healthy. Wear a sunscreen with a minimum of SPF 30 on your face daily, even in the wintertime. Your skin can say a lot about your health status. Drink plenty of water to stay hydrated and to keep your skin looking bright and fresh.
Here are some additional resources. Thank you for taking the time to listen to this presentation.